Assalamu alaikum dear viewers, I'm Dr. Nadia Kanval, teaching the topics of pathophysiology for BSc nursing. So first of all, we have to see that what is cellular adaptation. Cellular adaptation is actually these are the set of adaptive mechanisms which help the cell to adjust in case of any stimulus. That stimulus might be definitely injurious stimulus, either some inflammation factor, some radiation, any burn, any neoplastic change. So the stimulus, it can be some immunological factor, some pathogen can be there. So whenever there is some stimulus, then in response to that, there is ultimately this might lead to cell injury, and in response to that cell injury, there are various cell responses that can result in atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia, or neoplasia. Now, what is atrophy? Atrophy is actually the shrinkage of the cell. The cell is undergoing shrinkage because of an adaptive procedure, because of the persistent stimulus on that, and ultimately it has undergone atrophy. Now, what is hypertrophy? Hypertrophy is increase in the size of cell. Increase in size of the cell. So, as for example, you see in case of pregnancy when there is breast hypertrophy, because the mother is lactating mother, she has to breastfeed. So ultimately what happens that there is hypertrophy of the breast. And what is hyperplasia? This is not only an increase in the size, but also there is an increase in the number. So in case of hyperplasia, the example is in case of uterus. In pregnancy, there is hyperplasia of the uterus. That is, not only the size increased, but also the number of cells is also increased. Now, what is metaplasia? In response to some persistent stimulus, what happens? That there is transformation of one epithelium into another epithelium. And this epithelium is comparatively more resistant to the change. So, metaplasia is the transformation of one epithelium to another epithelium. And what is dysplasia? That is dysfunction of the cell. There might be some increased nuclear cytoplasmic ratio, and this in turn, if the stimulus is persistent, this can be finally neoplastic change, that is turns into new growth or neoplasia. These are the various cellular adaptive responses, and in response to some stimuli, these can be any injurious stimulus, any radiation factor, any pathogen, any immunological factor, any trauma, or any external stimulus that acts on the level of the cell, and these are the responses which occur at the level of the cell. Thank you.